Hi, my name is Adrienne Lindblad and I currently work in an ambulatory stroke prevention clinic at the Red Deer Hospital with Alberta Health Services. Over the last few years I've had the opportunity and the privilege to precept a number of different students and residents, so I'm very happy to be here today to talk to you about precepting the patient care database.
Hi, my name is Adrienne Lindblad and welcome to the session on preceptor development of the patient care process, developing a patient database. In terms of an outline of what we're going to talk about today, we're first going to set the stage for developing a patient database. We're then going to go through the elements of the patient database and discuss the interview both in terms of preparing your student as well as reviewing the database afterwards. We're going to talk about feedback and evaluation of your student, give you a description of the overview of the preceptor role, and provide you with an example of my practice. Hopefully all of this will get you to reflect on how you create a database to help you describe your process to your students. So by setting the stage, the first thing we want you to do is to evaluate and identify how you gather information to create a patient database in your practice. Think about your practice environment. Do you work in a community pharmacy, an ambulatory clinic, a hospital, or other? And think about the nature of your practice. Is it a collaborative practice or are you more independent? Do you work mainly by referrals? And how does prescribing fit into your practice? Think about your team members, if any. Do you work mainly with physicians, nurses, or other health professionals? What is the nature of your patient interactions which informs the data collection process? So for example, do you do complete head-to-toe assessments of your patients, or are your assessments a little more focused in nature, focused specifically on examples like drug selection or very disease-specific such as chronic disease management? Do you do a lot of medication histories and reconciliation, allergy assessments, adherence assessments, or do you do a combination of all of the above? And think about what your time allotment is for a typical patient interaction and how you prioritize patients on a daily basis. The next thing with setting the stage is really taking the time to get to know your student. Specifically, what is their comfort and experience with gathering information? Ask your student, how many patient interviews have they conducted? And what kinds of patients has your student had exposure to for creating a database? So for example, have they only worked in certain disease states such as diabetes? Or have they only worked with specific patient populations such as geriatric or pediatric patients? And finally, we want you to share your approach with your student. Do you use a patient database form or does your student have one that they like? What information can be gathered prior to a patient interview? And how do you access this information? So this could be information that you get from the community pharmacy records, your hospital pharmacy system, Netcare, or even the patient chart. And what are the common disease states that are commonly seen in your practice? When we talk about the database, there's really two big elements that we look at, the medical history and the medication history. Because we're pharmacists, we tend to conduct a more in-depth medication history than medical history. With respect to the medical history, the categories shown here are used in the medical model, so this creates a standard language that all health professionals can use. There are many potential types of information to be gathered to assess your patient for the presenting issue. Reflect on the aspects listed in the PCP document. Is this complete for your practice? Are there any elements that are missing or that you use more often? And what elements do you frequently review? With regards to the interview and preparing your student for it, one of the first things you want to consider is the location or environment in which the interview will take place. So for example, how do you maintain patient confidentiality in a hospital room with 6 patients who are only separated by a thin curtain? Or how do you maintain confidentiality in a busy community pharmacy where you may have a number of other customers around? These are important considerations for your student. Next, you want to frame the interview expectations and the purpose of the interview, so the student is clear on what they need to get out of the session. You also want to review timelines for the interview with the student. So does the student have 5 minutes to conduct an interview, or do they have half an hour? Of course, all of this needs to be confirmed with discussion on the patient to make sure that they have enough time to dedicate to that interview. You also need to discuss with your student the level of supervision that you would like. Are you going to want to directly witness the interview and be a part of it, or are you going to give the student a little bit more independence? Again, these expectations are very clear, so there's no misconceptions on either your or the student's part. The next step would be to review the pre-gathered information that your student has collected. So again, this would be the information that they've gotten from the patient chart or from Netcare or pharmacy records, whatever the case may be. You also want to share any known patient goals. What is the patient expecting from this interview? You also want to discuss questioning techniques. So what are some anticipated issues you can see with communication? So for example, I work with a lot of stroke patients who may have some difficulty communicating verbally. So I have to discuss that with my students and how we overcome it. You also want to discuss some of the types of questions that will best work for that interview setting. So we have here open-ended, closed-ended, and probing questions. Close-ended are the questions that typically have a yes or no answer to them, don't allow a lot of degree of openness from the person you're communicating with. They're quite passive and in general should be avoided. Open-ended questions, on the other hand, yield a lot more information. They permit open expression by the patient and are less likely to result in a misunderstanding. They help develop a trusting relationship between you and your patient. And finally, we have probing questions. These yield much more specific information as you delve into a specific issue based on the responses that your patient is giving you. Finally, you want to discuss how best to close the interview. You want to review the next steps with the patient and how follow-up will occur. We have this little precepting tip on the bottom here that talks about sharing strategies that you use in your practice for effective data gathering with your students. So as I mentioned, I work with a lot of patients who have communication problems. So I like to advise my students that it's okay to have silence in your communication with a patient. Give the patient the time to think and give them the time to tell you their story because you'll get much more information from them that way. Another tip that I like to share is that when I work with a lot of patients, acute stroke patients in the hospital, I often like to see if the patient is oriented to person, place, or time before the interview begins, just to allow me to determine how accurate the information is going to be that I get from my patient. So those are just the types of tips that I've learned over time in my practice that have really helped me a lot with data gathering from a patient. Once the interview is complete, you might want to review the database that your student has created with them. A few questions for you to think about is, do you want to review this information before or after the patient leaves? There are pros and cons to both. Some people like to have that discussion with the patient present, and some don't. It'll probably depend on the situation. You also want to determine whether or not the information gathered by the student was complete. Will it actually allow for an assessment of drug therapy? So for example, did the student forget to ask about allergies, or when they were discussing a patient's inhalers, did they forget to ask about what the patient's asthma control was really like? You then need to discuss a strategy for gathering the missed information. In some cases, it might be that the student forgot to ask the question, and in some cases it might be that the information is unavailable. So you need to think about what information is needed and how will it be gathered. A few examples of where you might want to look might be another interview with the patient, the medical chart, Netcare, the community pharmacy, physician, allied health providers, or some other source. With respect to feedback and evaluation, we want to provide feedback to students on three main areas: appropriateness, quality, and efficiency of the data collection. So with regards to appropriateness, one of the things we want to look at is professionalism, and was the student professional with their patient interactions? But appropriateness also refers to appropriateness of the situation. So, for example, if the issue at hand is asthma control, did the student spend too much time discussing other issues that are not related to asthma control, perhaps like the patient's arthritis, for example? So when it comes time for formal evaluation, it should be no surprise that we're going to be looking at the same three areas that we looked at with regard to feedback. So the first is appropriateness of information collected. Was too much or too little information collected by the student? Did the student focus the interview properly? And did your student exhibit professional behavior? Next, we want to look at quality and accuracy of the information collected. Did the student collect sufficient details within each area to create a standard database? And finally, we have to look at how efficient the student was in gathering information. Did they utilize time appropriately? Of course, students do tend to take more time, especially early on, than an experienced practitioner, but they do have to learn how to utilize that time in the most efficient way possible. We have a note here that is very important for you, is that if your student is unable to appropriately gather information despite feedback and sufficient practice, please contact the course coordinator as soon as possible. In terms of an overview of the preceptor role, we really have to break it down to before the placement, early on in the placement, and later on in the placement. So before the clinical placement begins, it's very helpful for you to inform your student about the types of patients they will be routinely seeing in your practice and what preparation will help them in creating a patient database for these patients. Early on in the clinical placement, you should discuss with your student your expectations for creating an appropriate patient database in your practice. This might include the level of independence you expect from your student, how complete of a database you expect, and of course, how the student can report their work back to you. You may also want to review the initial databases thoroughly with your student to determine their strengths and areas for improvement. And as the rotation progresses later and later, you might want to allow for more independent work by your student as appropriate depending on how they're doing. So in terms of precepting and the database in my practice, I currently work in an ambulatory stroke prevention clinic with a number of other health professionals. It's a busy clinic, and I'm lucky if I get about 10 minutes per patient interview. As a result, I need to do a lot of pre-work before the patients come in. So this means I have to review any available lab data, diagnostic tests, the referral letter, any information from Netcare. And this allows me to use my time with the patient to really get their perspective on their medications and get the kinds of things from them that I can't get from a patient chart. I don't tend to use a standard patient database form in my practice. However, I find it can be very beneficial for students to use a structured form just to work as a guide to ensure that they're getting all of the information that they should get from their interview. So I find this to be a really good opportunity to engage my students in selecting a database. So I like to ask them, what is their comfort level with building a database on a patient? Do they already have a database form that they like? And if not, I have a few different forms that I share with them, and I like to review them with them, discuss some of their pros and cons, see if any of them might better fit their needs, and see if they want to try any of them out. I also find it really useful to allow a lot of time for students to create a database. So in my practice, we only see patients in the afternoons, which means I have the mornings to prepare for that day's clinic by doing all of that pre-work necessary. So what I like to do is give my students 1 or 2 patients that they can start reviewing and start building that database in the morning. So hopefully 1 or 2 is not too overwhelming of a number for them, that they should be able to get all of that information put together before we see patients in the afternoon. Then in the afternoon, they can watch me with patients, and they can watch me with one of the patients that they've already done a lot of pre-work on to see how I structure my interview. And then after that, I can watch them do an interview on a patient that they've already started building that database for. And it really allows them to see my process and see theirs and compare them a little bit. I do like to allow some independence. So basically after I've seen a student lead one of the 2 of the interviews, I will let them continue on and do other interviews without me present. But I do like to do a thorough review of the database with that student once it's complete. So I teach my students a structured way to verbally report back to me so that I don't have to sit in on the interview with them, and I don't have to review the patient's full chart. I just get that information from the student themselves. Throughout all of this, I like to provide feedback on the appropriateness, quality, and efficiency of their database creation. And then after they've had a time to do a few sessions on their own, give them some time to think about their own process and reflect on them, I then like to see them in action again with another patient around the midpoint, so I can see how they've grown and provide a little bit more feedback to them. This is a process that students will continually build on throughout their careers, so any feedback that I can give them is invaluable. And I do have certain expectations of where I expect them to be, but I also expect them to learn that this is a process that they will grow with throughout their entire careers.